Health Spotlight, presented by Community Health Network.
In your Health Spotlight tonight, rotator cuff injuries caused by age, overuse, or a direct injury are painful.
News 8's Lena Pringle has a look at a new technique that's bringing relief to patients.
Shoulder rotator cuff injuries are extremely painful for the patient and challenging for surgeons. If the injury is massive, doctors hope for a functional outcome using different surgical techniques. One new method is giving surgeons an additional way to repair the tear.
It hits this thing. And
every year, 2 million people experience a tear in their rotator cuff. Rotator cuffs surround the shoulder joint, keeping the upper arm bone firmly within the shoulder socket.
And with a rotator cuff tear, this pulls off and is ripped off of this part of the bone. Oftentimes you're going to have a biceps problem occur with it. The idea is if you lose that top rotator cuff tendon, when you go to raise your arm over your head, the ball goes up in the joint as opposed to towards the socket.
Now, balloon spacers are providing surgeons much needed help in the operating room.
You put it in as just an unfilled balloon, think of it that way, and then you pump fluid saline into it and it props open that space.
Balloon spacers, recently approved by the FDA, come in different sizes. So Dr. Gasbaro determines the appropriate size of the balloon to fill the space.
You put small holes around the shoulder about the size of your pinky nail, you put a camera into the joint, and you use tools in and out of the other holes to manipulate this balloon or the rotator cuff, whatever you're fixing.
It's a new tool to help patients find relief.
Balloon spacers can be used in patients older than 65 years old without arthritis who can still elevate their arm above the level of their chin. I'm Lena Pringle for Wish TV, wishtv.com, and like us on Facebook.